Hello, everyone. Good morning, good afternoon, good evening. Thank you so much for joining us today for this learning session. We will be getting started momentarily. Before we begin, I wanted to let everyone know that today's session is being recorded, and I would also like to take a quick minute to just go over some housekeeping items. So we will keep you muted throughout the webinar, but encourage you to ask questions at any time during the presentations or the discussion by using the Q&A feature, which you can find at the bottom of your screen. We also encourage you to ask any general questions or comments by using the chat feature, which is also located at the bottom of your screen if you take a look at the chat icon. Lastly, if you're experiencing difficulties of any sort during the meeting, please direct any questions to our IT colleague, Sherry Hutchinson, in the chat box, and we will do our best to troubleshoot with you right away. Thank you again for joining, and I now have the pleasure of kicking off the event by introducing Thoai No, the Vice President of the Social and Behavioral Science Research Department here at the Population Council, who will be providing opening remarks for us this morning. So thank you, and off to you, Thoai.
Thank you, Anne Caroline. Good morning, good afternoon, and good evening, everyone. It's a great pleasure to welcome you all to this important learning seminar convened by the Population Council Humanitarian Task Force. To discuss conducting research in humanitarian setting, we have brought together a really exciting group of panelists and speakers today from around the world. For those of you who aren't yet familiar with the Council Humanitarian Task Force, or we call it ATF, by working with our partners, we bring together rigorous research capability, knowledge and experience, and expertise to produce effective and evidence-based solutions for people affected by complex emergency, natural disaster, and post-conflict crisis. And since the onset of the COVID-19 pandemic, the ATF quickly partnered with national health ministries and other government agencies across the world to produce relevant and timely evidence for decision makers to controlling the spread of coronavirus. And you can look at some of that work on our website. And more recently, we are beginning to assess the immediate and long-term health, social and economic effect from the pandemic. And I'm really pleased to kind of welcome everybody to this seminar today. As a scientist and as a refugee myself who have worked in northern Uganda, this topic is really close to my heart. We met at a critical moment for the international community and the humanitarian sector. The number of refugees had doubled in the last decade, and by the end of last year, 2020, at least almost 83 million people worldwide were forcibly displaced, which is more than 1% of the world population. Among them, 26 million are refugees, and about half are under the age of 18. So this is a rising generation who are forcibly displaced. On top of this displacement crisis, the COVID-19 pandemic has forced humanitarians in the field to create new programs, to innovate and to adapt existing one while continue to provide life-saving services in the safest manner possible while reducing COVID-19 transmission, as well as collecting quality data and evidence. Contrary to popular belief, the majority, about 86% of world's refugees are hosted in developing countries. More than 2/3 of all refugees displaced abroad came from just 5 countries: Myanmar, South Sudan, Venezuela, Afghanistan, and the Syrian Arab Republic. You will hear about the work in a few of those countries today from our panelists, all of whom have bring decades of experience conducting a wide range of research and program in many of the different type of humanitarian setting and contexts around the world. Doing research in humanitarian setting, and I have firsthand experience with this, is entail a distinct set of parameters compared to other settings. For instance, how and when to collect quality data, and how and when evidence is translated and disseminated that it can be used for programming and policy quickly. Often there may be an assumption that rigorous research cannot be conducted in such settings. So we will explore this assumption today its challenges and limitation. In today's learning seminar, we will hear from leading researchers who are working in various parts of the globe in different form of crisis and emergency at different stages of the crisis to better understand how are they doing quality research and how are they, most importantly, using that research to affect programming and policy and investment on the ground. We will also discuss how to best collect high quality data and generate rigorous evidence to address unique challenges in different settings. And we'll talk about some research gap as well and really mobilize the international community to invest in those gaps. I just want to say thank you again for joining us. Thank you to all speakers for joining the Population Council ATF. We're really excited to have you. I look forward to a compelling discussion. And as you think of questions, please post them in the Q&A box. Don't hesitate to be provocative or challenging in what is said during the seminar today. And I would like to invite my colleague Judith Bruce, the Council Senior Associate, who have been a champion of this work at the Council and elsewhere in the world. Judith, over to you.
Thank you so much, Thoai. You set the scene beautifully. I'm going to focus on some of the efforts over the last 12 years and beginning with a focus on what we've learned through partnerships on the ground and with practitioners. I should begin by saying the taxonomy of this, and Thoai hinted at that, is what is an emergency? Girls that we focused on have been living in an emergency. Now, when a real emergency happens, which means as externally defined, what happens to them? In our work, we began with, next slide, this kind of a theory of change where somewhat artificially we have grouped kinds of forces: conflict, climate change, geological incidents, health. Obviously, the whole health piece of this we have learned a huge amount about. But the broad theory of change is that all of these sudden disruptions and dislocations put very strong pressures on girls and young women through displacement, scarcity, and stress. Of course, there are many nuances in this, and climate change and health, I think we see, are going to be pervasive, ongoing emergencies, particularly for certain populations. In our theory of change, those who are already under exceptional stress, carrying exceptional burdens, will have those intensified, and how they manage them is key for us to know, obviously, so they may be supported. But the other piece, because we're focusing on learning, is that without knowing what they see and feel and experience, we will learn very little. The existing frame, when we came to this work, had very little to say about young females 10 to 22 or so. They were pretty much absent from the picture unless they were mothers. Next slide. So when the human rights movements and humanitarian crises and how they've engulfed the world bring some real problems, simply because we all have human rights. Everyone has rights and needs. Human rights are indivisible. Humanitarian can describe many different instances. How do we allocate the scarce resource that Thoai mentions, both our hearts and our minds, to learn? So these are some of the decisions we went through. Obviously, these aren't the tablets coming down. They're just the kind of taxonomy. Where to invest? Massive expulsions, likely long-acting complex emergencies, as the Syrian, certainly diaspora is. Established intergenerational settlements. Can you really make a difference? I think the work in Wajir recently showed you can. And plausibly short-term, which of course Myriam will speak about. The Haiti earthquake was one of many assaults on Haiti, and there have been many since, landslides in Guatemala, and so forth. I think it's important from the point of view of learning to purposely have different kinds of scenarios. Mass expulsion, of course, would cover the Rohingya and probably much more of this. And be clear that we come into it at a turbulent moment. We don't know where we're going with it, but some stratification of the kinds of situations we are seeking to learn about. Deciding who to work with and who to hear is vitally important. The shibboleths of information collection often actually exclude those at most risk or have a very external definition, e.g. malnourished children of a certain age, for example. We're particularly interested in who carries the highest dependency burden, that is not only under stress themselves, but expected to share their time, their food, their income if they have it. And those who within that have the least direct access to resources, least likely to have a food voucher, least likely to be able to get in line for grain and so forth. And we find girls often at risk, carrying a high dependency burden, but with no regular channel for voice or certainly access to resources. When becomes very important, both life cycle wise and the ways emergencies unfold, because there's a protocol of sequence. Teams come in that will set up often, you know, water, the wash, even where the schools will be. And that becomes in the first 6 weeks, the architecture for a community that may last a generation or even two. So when one has a population of special interest or populations of special interest, at what point in the emergency cycle, including the conventional emergency response cycle, are you going to intervene? Some of it's very difficult because efforts are both siloed substantively and temporally, and there are different sets of people, different sets of authorities and conventions you have to confront. Next. The timeline of efforts here is general and also just to sort of work as an advertisement to have you look at some of the materials we have. Our first really formal engagement was Haiti, earthquake, very intentionally. We had 4 months of, someone at Partners in Health called and described what was happening in the camps. AmeriCares and the Council with a lot of other partners met for 4 months. Then in July, after the earthquake, had a full-blown long workshop, and the Haitian Adolescent Girls Network, and I'm proud to say Myriam is here, was established with, I can't give credit to all the people who should be given credit to, but it was a real group effort, and it was, I think, fairly well prepared. And still we knew when we got there, we'd have a lot to learn. One example, we have an exercise called the asset exercise. And Catherine Farmer, the daughter of Paul Farmer, was 12 at the time. She was at the meeting, and we were going to ask what a girl of 8 needed, 8, 12, and so forth. And she said, girls of 6 need to know things too. So we had a 12-year-old telling us additional information. Basically, there's an army of field anthropologists there to tap into. We had a Girls in Emergencies meeting. I'll give you some of the highlights from that. We were engaged in Sierra Leone on the cusp of Ebola and worked right through it, again, with a committee before and even a standing committee there that operated during the crisis. The work in Lebanon was prepared several months, several years in advance to pick which sites to work in. Rima will discuss that. And then, of course, COVID has engulfed all of us, and it has been an extraordinary learning opportunity. Some of it quite uplifting when you see how much the extraordinary efforts of many groups, but including the girl leadership groups, to rise to the occasion. Next. Some of the basic findings from the initial seminar that I'm presenting, mainly to see if there's still the truth. The 6 times in emergencies, I'm not sure those still hold, but I think there still is an issue of sequential response and how it affects both learning and work we do in reaching populations. We found little activity was for populations of girls until time 6, that is after a year when many bad things had happened, very small efforts, non-scalable. In Zaatari camp, I remember there were programs that reached 300 girls, but there were 18,000 girls in the camp at the time. And the content at that time was knitting or something. And the girls were engulfed in a sea of child marriage. A challenge right now in the unlearning category for everyone is who is actually covered. There are many efforts that have nominally the name of youth, girls, child marriage, whatever. Who are they actually reaching? We found negligible preparation in most of the large efforts in advance to see what the adolescent girls and young women populations conditions were that might, in the case of a conflict or climate change, be more gravely affected. I think there's been progress there. I think a lot of the social cartography and layering of climate information will help us anticipate crises more. We looked at the procedures that the conventional procedures of registration of refugees and the vulnerability filters, as well as the research plans, and found that the girls at greatest risk carrying the greatest burden were not seen, their risk was not weighed, nor their contributions valued, and they were often under enumerated. as we've seen previously, you know, as a signal demographic sign. In China, the missing girls, Amartya Sen's work, Veena Majumdar, and the status of women in India in 1974, path-breaking, looking at the sex ratio at different ages. And as this registration and other processes go forward, you may see smaller populations. Suddenly, girls are under-enumerated. Why? Are they actually not there? What's the social process? But there was not a clear viewfinder to see these populations. That's a learning challenge. We found that when the sort of facts of the exploitation and burdens girls and women were carrying were put forward, there was an acceptance of sorts. Obviously, this huge exhaustion, people are working hard, but a lot of this, you know, girls and women out forming bad designs was accepted as inescapable givens. So one of the unlearnings also is, and it's abetted when we have good programs, is to say, don't give up on this thing you think is so hard. You can touch it. But there's an energy lag if people think they simply, it's inescapable and inevitable that girls and women are exploited. Overall, we recommended acting early in the emergency if you possibly could, early in the cycles and early in the lives of girls, seeking to both protect them and prioritize their and invest in their promise as leaders. Next slide. What the mentors and practitioners did was work as our field anthropologists, where you find words like caring, support, burden. You need the specificity of the learning that Thoai mentions. What is the real words? What are the real tasks? These are at least 4 things we find girls doing, but the details really matter. Household managers of younger members' welfare. That means knowing how to treat burns. That means getting medicines. That means handling schooling. That means finding food. Girls are often surrogate mothers. They're also partners with their mothers in many ways, including girls working in the fields at night when you wouldn't expect them, and functioning as co-providers and sort of surrogate husbands. They have to be protectors of their own security, and without dedicated efforts to bring them together, they have very few tools to actually protect themselves. We have found that content, mental health content, though no one will call it mental health, they'll call it stress or anger or confusion, is foundational, as are livelihoods, the content they need to protect themselves. We only find that out when we're on the ground. And lastly, certainly not least, we see how they respond in emergencies, doing things we never expected, including being the source of food security and water security, first line responders, and laying the foundations, we hope, for the resilience of their communities and future governance. Finally, here are some of the next slide. Here are some of the learnings we've confirmed on the ground across geography and over time. Committing to girl-only peer platforms. They don't have this. They need that space and to have access and private and safe access to each other. Males have much more access to places of their own. Females don't. Though in the course of this, only once did we actually have to build a special place, and that was in Haiti, in one of the earthquake sites. That was with IRC. This provides, these spaces aren't just for girls, they provide a community platform for learning, play, preventative healthcare, emergency mobilization, connectivity, and delivery of crucial services. The most regularly neglected populations across geographies are girls 10 to 14 and adolescent wives and mothers. Those at the highest reproductive risk rarely are covered. Another big unlearning point, who is actually covered unless there's dedicated recruitment and grouping. Mentors are absolutely vital, female mentors. The female infrastructure and leadership is critical to prevent, mitigate the effects of, and treat labor, sexual, reproductive risk burden on girls. And there is often a reluctance over time of organizations to stipend mentors. They begin to define what they do as that they have good hearts, that they're females, etc. We have been very insistent with our partners, and Myriam can certainly speak to this, even to join the Haitian Adolescent Girls Network, you had to commit to stipending your mentors. They are the ultimate resiliency asset, and I want to call them out as the best field anthropologists. The community workers, the mentors, are observing every day the girls, the families, and the communities. And then we can aspire to, don't always achieve, to build travelable, stress-resistant assets and peer networks. These populations have come from places, they're going places. rapid shifts in their environment. So we know how to build assets in more fixed places where people are more residentially secure. What kind of content and delivery strategy, including the possibilities of some of the mobile devices. I'm not a huge fan, but I think it's part of the picture. Based on a contextualized understanding of how scarcity is managed. That's very specific. And core livelihood, how core livelihood and food security frame risk. Finally, how social capital is created. And can you create it on the run? Can you create it in new places where tenancy is not secure? Grouping girls with others like themselves and proximate to them, but maybe some other strategies of generating social cohesion. There's a lot to learn there. Our latest resource, next slide, and last slide. We're proud to make available to all of you intentional design, which includes 5 reports from emergency settings. These are some of the learning tools that practitioners have applied, and it has been a two-way street all the way through. What we have done is provide a first draft, and in each case, as we expect, everyone will improve and contextualize the tools. Thank you for your time. I want to, and looking forward so much to the panel, so let me introduce Pooja Sripad. She's an associate at the Population Council, focuses her research at the intersection of women's health and rights globally, and she investigates trust. Pooja, that's the best part of your biography, and socio-political relationships. She looks critically at community health systems, has worked recently in Haiti and in Mexico, and she's a member of the Council's Humanitarian Task Force and our representative to the Interagency Working Group on Reproductive Health in Crises. Turning it over to you.
Judith, for that introduction and for your words. I think it's given us all a lot to think about. And I think as we get into the panel, some of those themes will come back in the discussion segment. So without further ado, I'd like to get us started so we can sort of get to the discussion part, which I think will be really engaging for the audience as well. So what we'll do first is to present a series of vignettes from 5 speakers that are sort of worked around the world. And we'll hear from them a little bit about what they're thinking in terms of methods, in terms of our engagement with in humanitarian settings. We'll hear about specific examples, a whole slew of things, and then we will kind of come back together and go through a moderated panel asking more specific questions about what they've spoken to us all about. So first we'll be starting with Rima Mourtada, who is a consultant of the Community of Practice, supporting its work in the Syrian diaspora, using her research experience in child marriage and health among these populations. She supports local organizations in implementing programs that are capable of meeting the needs of the hardest to reach populations, particularly refugee girls. So today we'll be hearing from her about how context-specific learning can influence program strategy. So Rima, I'd like to turn it over to you.
Thank you, Pooja. Good morning, good afternoon, good evening, everyone. Today, I will be describing the processes that led us to designing a life skills program for adolescent Syrian and Palestinian refugee girls residing in Lebanon. So when we first started planning for this work, this was in early 2019. We first started considering the countries that hosted the largest number of Syrian refugees, including Turkey, Jordan, and Lebanon. Then we decided on Lebanon because Lebanon is not a signatory of the convention related to the status of refugees. So unlike other neighboring countries, it did not establish proper camps or proper services for refugees. Also, Lebanon is the host of the largest number of Syrian refugees per capita. And it is already struggling with many political, economic, and limited resources. So this places refugees at an increased vulnerability and have huge implications on their access to services. So we decided to work with refugee women and girls in Lebanon, and we selected different and contrasting locations to work with those women and girls. because also residing in different locations in Lebanon have implications on their access to services and on their daily life circumstances. We started by choosing the Bekaa area that hosts a large number of Syrian refugees. We chose 6 towns, and we decided to look at the status of refugees residing inside the informal tented settlements, which are often located in agricultural areas, and as well refugees residing outside the settlements. We also chose South Beirut, 2 camps in South Beirut that host a large number of Syrian and Palestinian refugees. Those camps are slightly different in terms of context than the informal tented settlements in Bekaa. So we thought it would be interesting to see the differences in the situation of refugees between South Beirut and Bekaa. Then we we established a partnership with 2 Syrian trusted NGOs that work in those locations. We worked with their staff, we trained their staff on applying the Girl Roster tool. It is a tool developed by the Population Council in collaboration with other organizations. The aim is to provide a better picture of the girls' lived realities in certain programmatic areas. Next slide, please. So we were able to apply the Girl Roster approximately to 10,000 girls. The results were pretty interesting. First of all, we applied the Girl Roster tool on 10 to 24-year-olds, but we were particularly interested in the 10 to 17-year-olds. At least 8 or 9% of this age category of girls were currently out of school, and at least 23 or 24% of those girls who were previously in school were currently out of school. Interestingly enough, around 10% of the 13 to 17-year-old girls were currently married, and at least 66% had at least 1 pregnancy, and this figure reached 82% in South Beirut. When we looked at those girls' access, we already established that those girls are extremely vulnerable. So we were interested in looking at their access to services in terms of programs by existing NGOs in their areas where they lived. And it turned out that the majority, or more than 60% of the single girls who are out of school did not have access to such programs. And more than 80% of the married girls do not have access to such programs. And those who had access to the few programs in those areas, the programs they were attending did not address sexual or reproductive health services. This was particularly concerning given the high risk of adolescent pregnancy among this particular group. Next slide, please. So before I move on to describing our decision based on the results, I just want to describe briefly the overlapping crisis that hit Lebanon since the Syrian crisis. So since the start of the Syrian crisis in 2011, the Syrian crisis led to the displacement of a large number of Syrian refugees that started arriving in Lebanon in 2011. At the time, Lebanon was dealing with a lot of struggles, but there was a sudden deterioration in the political and economic situation in October 2019, and it's still ongoing. This was soon followed by the pandemic crisis, which started in Lebanon in last year, 2020 March, and it entailed prolonged and various periods of lockdown. These were soon followed by the 4th of August explosion, and today marks the first year anniversary of this explosion, which also deteriorated the various crises and increased the vulnerability of refugees. Next slide, please. So by the time we finished collecting the Girl Roster results, all those crises started appearing. So we decided to design a program that addresses the gaps in reaching and responding to 2 categories of girls: 10 to 14-year-old out of school girls, with the aim of preventing child marriage because it was very common, and 13 to 17-year-old married girls with the aim of preventing adolescent pregnancies and decreasing the risks of adolescent pregnancies. So when we started designing the content of this program, it was already, the pandemic crisis already started, and we were in lockdown. So we decided to carry out qualitative research, which was moderated by Skype by me, with the assistance of 2 local research assistants residing in Bika. We carried out various focus group discussions with girls and women from those age categories, as well as mothers and mothers-in-law of girls who married as children. Today, and due to time limitations, I'm just going to present the main findings which we obtained from the married females, and how these findings guided the design of one of the elements of the program that we introduced to married girls. So the main findings from our qualitative research showed that there was a shift in fertility preferences. Although the situation of refugees was difficult before, the younger age of girls who married usually at a young age prefer to have many children because of traditions, because of the extra support received from UNHCR at the time, because they think that using contraception have implications on their fertility. So our findings showed there was a shift in fertility preferences where most girls and women favoring limiting the number of their children, or at least delaying having children until after the crisis. And this was due to the mainly to the political and economic crisis, which caused an increase in consumer good prices and inflation that caused an increase, especially in the prices of diapers and milk. So many men lost their jobs because of the pandemic. There was limited mobility. So this has huge implications on people and their daily lives. So they were forced to think towards limiting the number of their children. Also, the UNHCR support, which was before the crisis, was enough for them. It was no longer able to keep up with the inflation. So shift in fertility preferences. At the same time, there was a potential increase in their demand for modern contraception, which is something we didn't see before, especially among this age category. So a few women reported desiring to use modern contraception methods, or wanting to use it, or they were already using it. But at the same time, all those crises had implications on their access to sexual and reproductive health services. Their access was compromised because of the limited mobility, because of the cost implications of accessing services, because of concern catching coronavirus while going to the health facility or at the health facility. Also, there were extra measures imposed by health centers and health facilities to control coronavirus. So women were forced to wait outside the facilities. They were forced to wear a mask, which was often not provided by those health centers. So they were denied entering the health center if they did not have a mask. Also, many health centers used to provide contraception pills for free, and this was not the case anymore. Many women residing in the settlements used to receive those contraception pills from outreach services, and these were no longer provided. So as a result, many women had to depend on natural contraception methods, which resulted in unwanted pregnancies. And some actually reported, resorting to abortion, whether by a doctor or, induced abortion.
Did we lose Rima? I think her connection may have dropped. Well, let's hopefully she will be able to.
I'm sorry, I'm back. We
no
have an electricity issue. Today is a little bit chaotic in Lebanon, and we had an electricity issue. So sorry about that. So I'll just be brief. It's the last slide. So when we asked those women, given all those problems, what do you think would improve your access to reproductive health services? A number of them raised the issue of limited mobility, and some of them were seeking care with private health providers, and they highlighted the advantage of being able to communicate via WhatsApp with those doctors, which solved a lot of their problems. Many women also raised the issue of being able to communicate with Syrian doctors because they felt more comfortable. So based on those findings, we decided to introduce an element in our program, which is a virtual WhatsApp platform that would allow women to communicate with 2 Syrian female doctors, gynecologists, and address any issues. The doctors would address any issues that those women are facing. So it is not really a structured intervention, but it includes several elements that we would like to test. So the WhatsApp activity aim is to deliver weekly online educational audiovisual material, because this would also serve the women who do not read or write. The doctors would provide information on modern contraception methods, how to access them. They would answer any questions privately. We know that young women in this age, 13 to 17, when they go to the doctor, they're often accompanied by their mothers-in-law or their husbands. So they are unable to voice any concerns in the presence of other family members. So this activity would allow those women to address any issues privately, even including things that are not related to reproductive health, such as gender-based violence or anything that women are worried about. Also, given the all uncertainties and the changes in accessing those services induced by the crisis, doctors would educate women about the location of health services that provide services that are still providing services for free or still providing contraception for free. And also doctors will be able to address any urgent issues, especially by pregnant women who need emergency services. So although we haven't yet officially evaluated the outcome of this activity because the program is still ongoing, but we are already hearing positive feedback through our mentors from women that they found this extremely useful. It's increased their access to services in their areas, and also many of their concerns are being answered by the 2 gynecologists. So this is in brief just how these processes led us to design one of the elements in our program intended for young married girls. Thank you so much.
Thank you so much, Rima. And I would just kindly ask the presenters to try to keep their vignettes to 5 minutes so we can get to the discussion. And I think there's a lot of rich material you've presented here, so thanks so much for that. So moving right along to Dr. Neha Singh, who is the co-director of the Health and Humanitarian Crisis Center at London School. She has a background in public health and expertise in health policy and systems research. She uses mixed methods to improve the prioritization, design, and delivery of women's, children's, and adolescent health in humanitarian crises and under-resourced settings. So Neha, I'll turn it over to you to hear a bit about how we may want to consider transforming the process of doing research in humanitarian settings. So Neha.
Thank you so much for having me here today. So yeah, Pooja, as you said, my research largely focuses on improving women's, adolescents, and children's health in conflict settings. But today I've wanted to sort of zoom out for a minute and briefly talk about the actual process of doing research in crisis settings to be more equitable and participatory. These are definitely not new concepts. People have been working on this for decades. So why am I talking about this today? So as Thoai mentioned at the start of this session, we know that COVID has deepened inequities and undermined health, human rights, and gender equality for forcibly displaced populations. This ongoing pandemic has also exposed persisting power hierarchies between researchers and forcibly displaced populations. These forcibly displaced populations experience power asymmetries in their position as the so-called beneficiaries of humanitarian research and action, and are often excluded from participation in decision-making about the research that's actually intended to benefit them and their communities. Forcibly displaced women and girls are also consistently categorized as vulnerable or needing protection or rescuing, which really takes away their agency and power of action while risking exploitation or abuse by the very same humanitarian actors that are supposedly aiming to protect them. So recent efforts to address these hierarchies through the process of localization, which can be defined as recognizing, respecting, and strengthening leadership by local authorities and the capacity of local civil society and humanitarian action to better address the needs of affected populations and to better prepare humanitarian actors for future responses. But this process of localization has been criticized for neglecting the effects of sexism and racism, which are both very intrinsically linked to colonial legacies. This perceived urgency to collect data and during the pandemic, collect data remotely also exposes neo-colonial power hierarchies between researchers in affected settings and those in resource-rich settings like the UK where I'm based and high-income countries where funding is often concentrated. So we know that researchers from advanced economies predominantly define the research questions with very little, or I would argue, tokenistic consultation of in-country researchers or frontline researchers or communities. And with all the COVID-related movement restrictions, research can typically only be done by collecting data remotely or by delegating data collection to the more frontline researchers. In the rush to produce all this evidence, interactions can become one-sided or top-down, as those in higher positions issue directives to more frontline actors. So the new nature of all these interactions also risks the so-called ethics dumping, which is offloading risk to in-country researchers by asking them to facilitate data collection under the unique challenges presented in humanitarian settings and also by the pandemic. And these hurdles demand that researchers confront power hierarchies in knowledge production processes. So confronted with all of these issues I just talked about during the pandemic, and recognizing that COVID has presented a crucial opportunity for researchers working with forcibly displaced populations to rethink their traditional approaches. A few of us from the academic, donor, and practitioner communities, including Undie, who's here on the panel with us today, had some focused discussions starting last year on moving beyond lip service to think about how do we concretely make research more equitable in humanitarian settings. And this led to a short article in The Lancet that was published earlier this year, where we proposed sort of moving beyond the performative dimensions of being gender sensitive and decolonial towards understanding what it means to equitably share power within research collaborations in a meaningful way that challenges traditional methods of knowledge production. And we argue that applying feminist values to data collection during COVID and beyond requires putting at the very center the knowledge of those from whom data are being collected. And we provide a few key recommendations and a detailed checklist that's not exhaustive, but it takes into account ethical, gender, and decolonial considerations when collecting data in forced displacement settings. So I'm just going to take a minute and pop into the chat box these recommendations that we made. And I think we're running a little bit short on time. So what I'm going to do is I was going to give a few examples of how to actually do this, but I believe that a few of us are already going to touch on this in the panel discussion after. I've also popped a link in the chat box to the actual paper itself, but I just wanted to say that, we sort of organized it by all stages of data collection and recognizing that, I'm not calling it research on purpose because we know that humanitarian actors, it might be embedded within their own monitoring and evaluation programs or other evaluations. It's not all sort of pure academic research, but thinking really about from how do you be more equitable? How do you sort of integrate participation everywhere from conceptualizing your research and data collection to the funding, to which can be touchy, research design, collecting data analysis and dissemination. And this knowledge production It's like, I mean, it really needs to transform, but I'd be remiss if I didn't say that we know that dismantling these well-established data collection practices, especially in forced displacement settings, requires a sustained commitment from all parties in the research ecosystem and changes to the architecture that really enables these practices. But I'd argue that, COVID has really given us the opportunity to reflect on and challenge these long existing power hierarchies. And it's a process that is needed to sort of address lingering colonial and patriarchal power relations and to avoid ethical pitfalls, which is also something I think we can discuss later in the panel. So I just conclude by saying that I really believe, applying a feminist lens is not just about demolishing problematic structures, but it's really about collaboratively, sorry, I'm having trouble speaking today, I'm getting over a cold. Sort of building up new structures for a more just world. So I'll leave you with that, and I look forward to sort of discussing more concrete examples in the discussion.
Thanks so much, Neha. And I think, yeah, absolutely agree that this is such an important thing to start thinking and unpacking, unlearning, breaking down power structures, and I think hope to talk more about that in the discussion. And as you started by telling us a little bit about engagement and participation, I think the next speaker I'd like to introduce is Miriam Narcisses, who will tell us a little bit more about that in the context of Haiti in particular. Miriam is a passionate advocate for girls and women's rights who's been working for over 15 years in adolescent girl, youth, women focused programming, particularly in Haiti through the Haiti Adolescent Girls Network. Which is a Haitian nonprofit that promotes adolescent girl and youth empowerment. So Myriam, over to you.
Thank you, Pooja. Good morning, good afternoon, good evening, everyone. It's really an honor to be part of this webinar and share about some of Hagen's experience building data collection into our approach to reaching and supporting adolescent girls and young women, especially in humanitarian crisis. The devastating earthquake of 2010 was only the first of many humanitarian crises that affected the Haitian people, from the cholera to recurring hurricanes, to political instability, and even to this day, with COVID-19 and gang-related violence. So when Hagen was established in October 2010, the learning agenda was very clear. It was really to respond to the needs on the ground, and address the needs of girls identified through the promotion of safe and supportive peer space for excluded and vulnerable girls to build their social, protective, and economic capital with the support of young female community-based mentors. Previous slide, please. So despite recurring crisis and stress, a systematic approach to collecting information has been regularly followed to identify key segments of population of girls in intervention area. So incorporated in 2016, Hagen has increased its presence and coverage, and today has a growing platform of over 180 mentors working in active urban and rural sites that are in red in the map, and reaching over 7,000 girls and young women this year. Next slide, please. So this map highlights the work on the ground. As the communities are being repeatedly cut off and dealing with scarcity and escalating violence, trusted mentors, locally recruited and trained, using phones and also in person, they have remained on the ground as the first social responders and continue to support an average of workload of 50 to 100 girls and perform a series of tasks that include but are not limited to gathering information from households for prioritization and recruitment of participants using the girl roster that was mentioned earlier, door-to-door community awareness raising on COVID prevention, facilitation of weekly sessions on sexual and reproductive health, financial literacy, household visits to girls who have no access to telephones, support for access to health services and other entitlements such as savings, and the list goes on. Not to forget the community alert. So the mentors who are on the ground, they receive support in person from a coordinator who oftentimes is a representative of a partner organization that is a grassroots organizations also already working in the communities. And they are connected through WhatsApp throughout the country for mutual learning and support. And that also helps help them access additional resources, especially for areas where there is restricted physical access. They are also compensated through mobile money that is sent to their phone, and with the broker's fee built into the monthly stipends, and it is easily redeemable in their community. So that way their access to resources is sustained, and it is reducing at the same time the vulnerability and risk to their safety. Next slide, please. So despite a cascade of catastrophic events and mounting stress, ongoing collection and analysis of information effectively supported our work in making thoughtful selections on where to work using disaggregated data. As you can see on the right-hand side of your screen, there is an example of output table. This is a report that is produced from the girl roster that was mentioned earlier. And this is one example of data collected in one of our communities in the southern area of Port-au-Prince. And as it is showing here, it clearly shows that one of our partner organizations who's been working in a community for many years, who has a recognized dedication, was not actually reaching the key segments of population. So if you look at the information we have on that output table, they were reaching less than 20% of the population of girls in that community. So that type of information that we collected is also very useful in helping our program to see those girls that are being left out, that are being left behind, and include them in a tailored asset building program. So with the nominal dedication to girls and the presence in the right place, what we've learned is that intentional recruitment is key to reaching and including most excluded girls in program, especially in humanitarian crisis. The other lessons we've learned also is that there is a huge value also of sorting girl participants into light situation populations. If you look at a country like Haiti, where at least 60% of the population is below the age of 25, we're dealing with a very young population. And half of that, we're talking about girls, less than 25 years old. So using the subnational level data and pulling key information from the girls in the defined communities for intervention was really instrumental in ensuring that key segments have been prioritized in our programming, namely the very young adolescent girls, the girls with the babies, and domestic servitude, and girls with disabilities, enriched with the right content. The last thing that I would like to share is that also throughout the whole close to 12 years, where as the disasters, we had a recurring of disasters, of humanitarian crisis, the network continued to grow. And it was really relying heavily on the value of our mentors, who are trained local resources, who continue to remain active, to continue to keep in touch with the communities and continue support them for reproductive health access channel, security and safety protectors, and effectively reaching the most vulnerable. So they were really instrumental in supporting the response and delivery and strengthen the recovery and community resilience, reaching the most vulnerable in an accountable way. So I know we are very pressed for time. I'll conclude to say that today, Hagen's story is a story of survival. And if we look ahead, there is really a great promise and potential to leverage the best practices and build long-term resilience assets in these populations and the families and communities they're part of, through an investment in them, not just as participants and as actors. So I really look forward to discussing more in the discussion section of the Q&A. Thank you very much for your attention, and over to you, Pooja.
Thanks so much, Myriam. and look forward to more on that in the discussion as you mentioned. So to keep us moving right along, we next have Dr. Hannah Tappis, who's a Senior Measurement and Evaluation Learning Advisor at Jhpiego, as well as an affiliate faculty at Johns Hopkins University. Her work focuses on generating and using evidence to improve the quality of reproductive, maternal, and child health services in conflict settings. She has over 15 years of experience working with ministries of health, UN agencies, international and local NGOs in several countries across the world. She's also the co-chair of the Interagency Working Group for Reproductive Health and Crisis, Maternal and Newborn Health Committee, and also a member of several other interagency initiatives. So today we'll be hearing from Hannah about transferability of measurement approaches with some examples from Afghanistan, as well as some new studies that are being launched.
Thanks so much, Pooja, and to everyone for the opportunity to join this discussion today with such esteemed and accomplished researchers from all over the world. It's really a pleasure to be able to share some of the experiences that we've had and discuss some of the similarities and differences across, quite a wide but related range of research areas and humanitarian settings around the world. So to start, I'd like to share a little bit about Jhpiego's experience conducting research and supporting the Ministry of Health in Afghanistan to improve maternal and newborn health services over the last 15 years or so, through many periods of ups and downs in terms of security and natural disasters, humanitarian crises. I'm sure everyone has seen the news lately from Afghanistan, so I won't get into much of the context there, but just to say that the last 5 years have been a particularly challenging period with increasing insecurity across the country, including attacks on healthcare facilities, and healthcare workers. One of the main research and programming areas that we've been focusing on with the Ministry of Health and partners over these years has been quality of care, together with growing global attention to the importance of quality, but particularly in crisis-affected settings and in a context like Afghanistan, where there's just been such need and dramatic focus on scaling up access to health services. The focus on quality was really quite a pivot in terms of resources and attention. And so in 2016, with support from USAID and UNICEF, we conducted a national assessment of quality of maternal and newborn health services at health facilities across the country. And this was really the first study of its kind. Other studies looking at quality of services use, outpatient care or child health services as the tracer benchmark for general quality of services in the health system. But we know, and Rima and others have highlighted, the additional complexities and sometimes differences in reproductive and maternal health care. So this was a pivotal study in that sense. The methods used for this assessment and some qualitative follow-up studies shown on the screen are similar to those that we've used and other partners have used around the world, with some additional practical considerations we may discuss in the panel, but considerations you would have for implementing any programs or research in conflict-affected settings. And the empirical findings from the study were important, and you've noted on the bottom of the screen a few examples of the ways that these findings on both the sort of clinical quality of care as well as the experience of care and interpersonal dynamics between providers and patients have helped to shift programming over the last few years. But what I wanted to highlight in our short time today is some of the learning we have around acknowledging the additional complexities in factors affecting health service delivery in conflict-affected settings, many of which have been highlighted by other panelists so far. But really the importance and value of planning for and integrating multidisciplinary approaches to analysis. So while the health facility assessment and service delivery observation data collection methods were quite standard, Some of the richest insights that we had from these studies were actually from the engagement of the data collection teams, which in our case were female midwives and doctors at different points in their career, not necessarily researchers by training, and engaging them in reflections about their own experiences as health workers and how that influenced what they observed or how they observed care during these assessments, or what they heard and how that was interpreted during the data collection processes. So this is, quite common debriefing methods in qualitative research, but sometimes less so in clinical or programmatic studies. And we recently published some of the reflections. I can share a link in the chat as well, including the need for deeper understanding of the ways in which violence and stress are normalized after decades of conflict in Afghanistan. What the data collection teams and the health workers themselves accepted as just, this is how things work and not noteworthy in any way, and what they felt was important to highlight, and how this was influenced by, quite complex power dynamics or individual or collective mechanisms for coping with uncertainty, with insecurity, and how this affects the environment in which care is provided. So a lot of these insights, I think, could seem, perhaps academic in nature, or, nice to know, but not essential to driving programming and maintaining service delivery in, increasingly crisis-affected settings. But wanted to highlight how incredibly valuable they've been in the last few years since this work was conducted, and continue to be valuable for those who are involved in the data collection and those who've been able to engage with the findings in terms of thinking about what is essential or not in terms of programming in humanitarian settings, or how to adapt strategies to support health workers, to maintain services, to adapt service delivery models amidst increasing insecurity or the COVID pandemic. I think some of our colleagues shared other examples, and that, exploring these issues has taken a lot more time. So these are sort of findings we've been able to dig deeper in and continue to use after the initial empirical findings were shared to, inform program strategies. So in many ways, this is sort of outside of what was conceived as the research process and study. So touching on Neha's reflections on really thinking about engaging those closest to the work throughout all phases of the process. This thinking about, further reflections and engagement, not just of those closest, but outreach to different fields of academics and multidisciplinary experts. Since the initial findings were shared, we've engaged further with experts in anthropology, with mental health and psychosocial support, among other fields, to help unpack some of this and really understand how to interpret these findings, how to take some of the issues that emerged into account, and then evaluating the programs that have emerged out of this work. And I think it can be often challenging to make the case for such robust research, or for taking the time and resources to test and adapt measurement tools or metrics from other settings in an environment where there's constrained resources, greater focus on meeting basic needs, access to services, but we've just seen so many benefits in terms of informing programming and reflections by investing in this more robust research, both to be able to understand what is similar and different, what is transferable across crisis-affected and less crisis-affected settings, either within the country or globally, and also how considerations evolve over time. So being able to conduct this research and more rigorous multidisciplinary analysis in areas that were quite conflict affected, and have that as a benchmark as the conflict dynamics change and spread throughout the country, has been a really valuable benchmark. So next slide, please. I do want to say, in looking at this, we struggled to find examples of similar research conducted in other settings that would let us, lend some insights, compare what the teams in Afghanistan were experiencing and learning. And this is really emerging as a gap. But I think over the last few years that has changed, and quite excited about the growing recognition of, potential of more robust longitudinal analysis in crisis affected settings and, dynamic, rapidly changing settings, adaptation of methods to these. So quite excited to hear, what others on the panel are doing and about some future work that we have planned with a consortium led by International Rescue Committee with academic institutions in 4 countries, in DRC, Nigeria, Somalia, and South Sudan. So this is work that we'll be embarking on as part of a 5-year UK aid-funded research consortium, looking at, as you can see here, many of the aspects that were emerging in terms of their influence on maternal and newborn health services in the most conflict-affected areas in these countries. So really excited to be able to learn and to participate in exchange, across different settings, in gathering deeper understanding of what is transferable in terms of methods or programming approaches, and how we can learn together, including engaging those closest to work in these challenging settings. So with that, Pooja, I'll hand back to you.
Thanks, Hannah. And I will now introduce our final speaker, Undie, who's a senior associate at the Pop Council. And since being at the council since 2009, she's focused on sexual and gender-based violence research and adolescent girls. She's served as project director for the council-led Africa Regional SGBV Network, and sort of works across countries with several partners around SGBV response in East and Southern Africa. Today, she'll be speaking to us a little bit about research uptake, and we look forward to hearing that.
Thank you, Pooja. Hello, everyone, and I hope you can hear me. Yes, so I will be talking a little bit about research uptake and the opportunities that refugee settings present for this sort of effort, which really allows research results to live on well beyond our specific projects and funding cycles. So in June 2012, I still remember the date, I happened to be in the same room as a UNHCR representative. And I was giving a presentation on some aspects of the Population Council's work. The work was SGBV focused. It was also multi-sectoral. And so through our network of SGBV partners, we were carrying out interventions and research in health facilities and schools, police stations, and wider communities on a regional level in a bid to foster a multi-sectoral response to sexual and gender-based violence. And the UNHCR representative said, have you thought about carrying out this sort of work in refugee contexts? Refugee settlements and camps have health facilities, we have schools, we have police stations. We're looking for innovative solutions to SGBV concerns, and we think that the model you're employing in non-refugee settings would translate well. And so a light bulb went off for us in that moment, and we've been working in refugee settings in the East and Horn of Africa and Great Lakes region in collaboration with UNHCR, UNHCR's regional hub in Nairobi ever since 2013. And since then, we've had the privilege of adapting 5 different SGBV interventions for implementation or testing or scale up in refugee contexts across at least 6 countries in this same region. And just to give you an example of how a seemingly quote unquote small research study in refugee settings can take on a life of its own well beyond the initial project period. One of the interventions developed under the Population Council's regional network is referred to as the Zero Tolerance Village Alliance model. It's a community-based, community-led SGBV prevention model. It was adapted and tested in non-refugee settings first, and then in refugee settings in Uganda. And it's since been independently replicated by UNHCR implementing partners in at least 15 different refugee sites in Uganda, and has also spread to other countries such as Ethiopia, Zambia, and Nigeria. Another intervention developed and incubated within our network, a screening intervention that identifies women experiencing intimate partner violence and then connects them to comprehensive care, was also adapted and tested in Ugandan refugee settings and has since spread to 12 refugee camps or settlements across 4 countries, representing many more health facilities where this work continues long after our departure. And lastly, a similar screening intervention that we designed to detect and support child survivors of sexual violence in school settings was adapted for refugee contexts in Rwanda in collaboration with UNHCR Rwanda and other implementing partners on the ground. And right before COVID-19 hit, UNHCR Rwanda was preparing to roll this intervention out to all of its camps nationally, with funding anticipated from a donor who had expressed interest, but with the pandemic, school closures and so on, these plans were interrupted. And this is just really a tip of the iceberg when it comes to the possibilities for research uptake and impact in a context that is eager for evidence-based solutions designed for low resource settings. And if we think about it, in an environment where people are used to being in emergency mode and used to attending to basic needs, many of the interventions that we take for granted in non-refugee settings are often seen as very refreshing and are often very much needed. So if research uptake and long-lasting impact are your goals, and who doesn't share these goals really, then I would say that humanitarian settings, refugee contexts should definitely be on your radar. I'm gonna stop there, Pooja, because I realize our time is almost up. So thank you.
Thanks so much, Chi-Chi. And I think what we will go ahead and do, I noticed that there are several questions in the chat and we have some structured questions that we were thinking of asking the panelists. So I will try to do a combination so we get everyone to be able to respond. So just to start off, I think what I will ask Myriam and Chi-Chi to reflect on is to sort of this false paradox of rigorous research, sort of as being whether that's possible, what is possible in emergencies. I'd like us to kind of reflect on the learning that we can do and what has been successful in your experience. I know Myriam mentioned sort of the success that the model, the Hagen model, sort of posed in Haiti. So perhaps Myriam, if you want to reflect a little bit about that, how sort of you were able to what that looked like, why that is successful and what that meant in the Haitian context, that would be great.
Thank you, Pooja. One of the things that we prioritize from the onset of the program implementation, and was really systematic in every community, was really to hold what we call community consultations. So from day one, the communities, the community key stakeholders, the leaders, be religious or legal, elected officials, and community members. It is a very intense process, but very rewarding, because when the community is engaged from day one, they really understand the value of understanding not just what is going on in the community, but also engaging the girls that actually need the program. And there are so many grassroots organizations also that are really on board right from the start. So the interesting thing with the Girl Buster is that it is a tool that's really very easy to implement. It is really a non-sensitive survey that can be downloaded onto Androids. So that really was very good because in our communities, we're dealing with scarcity of power, poor connectivity. But with the consultations we had with the communities, with the engagement on young people and leaders, they were the ones who actually did the exercise. So they were really engaged. it was because the tool was easy, so training them was really easy, and they could go door to door, collect information, and they are already recognized and trusted, and they have a legitimacy in the communities. And then they could, when they could have a little bit of a connectivity with little power, so they could upload, and producing the reports was really was very easy. And the very interesting part is really the step after collecting information when we do the analysis with them, because they are engaged at every step. So which I think was really instrumental to the success of this approach, because when we get the information, we sit with them and we analyze it. So that way, there is also a level of capacity building that is being done with those community-based organizations and those leaders. So they are really acquiring useful information that they can use to adapt and improve their programming or create new programming, because they are community-based organizations working in the communities. And the interesting part also is that almost all the times, the young people that are engaged in that process are the potential mentors. So right from the start, there is a process of engagement, an ongoing engagement that is really happening in the communities from the start. So it really made it very successful and engaged the communities.
Thanks. I guess I'll just add on and say that, in terms of the false paradox around, the impossibility of research, rigorous research in refugee settings, I'll just briefly say that we need to remember that refugee settings do not represent a monolith. There are different kinds of refugee settings across the spectrum, across the continuum of emergencies, and we need to get out of our comfort zone and begin to try. When we think of the fact that we have certain refugees who have grown up, spent decades, they're in adulthood now, they've grown up in refugee settings, it really should make us begin to question, what we mean when we say, oh, we just can't do this because, it's too volatile, there's too much mobility, there's too much. Yes, that's the case for some settings, but not for all. So I would say, let us identify settings in which this can be done and at least test it out. And that is one thing that we are planning to do under the Population Council's new research program consortium, referred to as BAOBAP, where we will be finally trying to move well-regarded, rigorous surveys that have been used for a long time in non-refugee settings into the refugee space, such as the Violence Against Children survey by CDC and Together for Girls, such as the abortion incidence survey done by Guttmacher, such as the longitudinal unintended pregnancy survey. I mean, there are a number of surveys that we would like to try out to finally be able to say something definitive about the state of sexual and reproductive health in refugee settings. Thanks.
Thanks, Chi-Chi. I would also like to ask Rima, just to kind of reflect on this as well, because I know this came up in her talk.
Thank you, Pooja. Yes, I mean, as Myriam and Chi-Chi indicated, community consultation is of extreme importance. Also knowing your research setting is very important. So when we wanted to design the content of our program, I was planning to go and have face-to-face meetings with those women. Unfortunately, the pandemic crisis happened and there was limited travel. I wasn't able to travel. I'm residing in Beirut, and traveling to Bekaa entailed a huge risk for me. Also, it wasn't allowed to travel from one area to another. So we had to tap into the already existing resources and find innovative ways to collect information without causing huge delays to our program. And of course, it's a learning experience. When I thought about moderating those sessions via Skype, it was something that I haven't done before. So we had to engage, it wasn't a process that we decided to jump into immediately. I had to engage in community consultations, in exploring the setting with two local research assistants who are already residing in those communities, to explore the feasibility of doing such collecting information via Skype, because we didn't want to invade the privacy of women. We wanted them to be 100% comfortable. Another concern was the internet connection, because it's already in Beirut, it's already weak. So how it's going to be when you go in a camp and connects, to Skype. So the preparation steps took a little bit over a month to make sure that everything was set and women were comfortable. And before starting the actual focus group discussions, I had a conversation with those women, like half an hour, to make them feel completely comfortable, to make them feel at ease, to answer any questions they may have had about the method of data collection, because some of them were concerned about someone taking photographs, or their privacy being invaded, or men being present. So we didn't start actually collecting data until we made sure that women were at ease. We made sure that the method is feasible. We made sure that also the method did not compromise their health, because at the time COVID was already spreading. So we made sure that women were in a large room or a large tent. There was appropriate space between them. They all wore masks. We chose the settlements that did not have any COVID cases to ensure the safety of women and the research assistants. So yes, there are challenges, but engaging in giving enough time to engage with community consultations and to explore the feasibility of such options ahead of time is of great help. And it's a learning process. I mean, refugees settings are challenging, and we're learning every day. So it's a learning process. This learning process in itself is actually rigorous research as well.
Absolutely. No, I think that's completely correct. And we've heard about interdisciplinary. I mean, I think Hannah mentioned that, and I'd like to turn it over to Neha maybe now to reflect a little bit on, we've heard a lot about participation and engagement, but some of the ethical challenges. And I think you were going to provide a few examples, Neha, about how you're kind of reshaping it or thinking about how to restructure the research partnership. So it'd be great to hear about that.
Thank you. I mean, I might just start with maybe one or two examples, but please, I think we have a lot to learn from the brilliant panelists here. I mean, this is perhaps more well known amongst those researching sexual and reproductive health and sexual and gender-based violence, but thinking about ethical issues faced by participants. I know there's been a lot of, we know that COVID has had a lot of indirect impacts on women's health and their choices and their autonomy during COVID. And it's been, I'll just give you a little anecdote maybe from some work that I am involved in with colleagues in DRC and Northern Uganda. And when COVID hit, we were working on something, it was mental health and maternal health. And suddenly everyone went, oh, let's start collecting data on SGBV because we're hearing so much about domestic violence and intimate partner violence and these restrictions and all that. And, we already had ethical approval to go ahead and do some COVID related data collection. And I think rightly pointed out by, I think, a number of experts, including those at WHO and on IWAG and others, were saying, no, if you can't, what benefit is the community having? What benefit will this woman have in answering questions related to SGBV, for example? And especially, I mean, there's a few ethical issues there, right? So if you're thinking about collecting data during COVID and you're thinking about collecting it over the phone or through remote technologies, thinking about that person you're collecting data from, do they have privacy? Are they sharing their phones? Can someone, are they in a safe situation? What happens to, going beyond the principle of do no harm, but how are you actually going to benefit them? So if you take all this, if you collect all these data from them, unless you can actually directly in that moment, or pretty soon sort of improve programming and it can be linked back to them, is that really ethical to be doing that? Even if you could do some interesting methodological work or SGBV work and publish a paper off it, is that ethical? So I mean, I know I know not everything is black and white, but these are, and in our research team, and I don't just mean in the UK, I mean in DRC and Uganda, we had a lot of debate around it and people sort of all ends of the spectrum. But for me, I strongly felt that if you're exacerbating any risk for participants, we ethically can't do it. And we can't say, oh, we'll write a report and give it to NTI or UNHCR and hope they do something with it. To me, it didn't feel sort of good enough. And then I think just I mentioned very briefly in the sort of talk earlier, but this issue of ethics dumping. And I think I've been thinking a lot about, you know, additional risks that a lot of frontline researchers, and who are often, as Hannah pointed out, frontline sort of care providers, take to collect data, record data, and all of that. And what, you know, just ensuring that I don't just mean those of us sitting in high income countries, but those of us even sitting in regional offices or capital cities or whatever it is, what care are we taking to make sure that this is not an extractive process? You know, how are they being supported? I don't just mean financially. Also, when it comes to data analysis and writing up, are they just some random middle author on the acknowledgements? You know, did you take the time to actually work with them where appropriate and possible, have them analyze data, have them write the reports, or have them really solidly, meaningfully contribute and really get them, you know, work with people respectfully. And I think this is where respect and ethics kind of intermingles. And I'm rambling a little bit now, but I'll stop with these two.
No, I think it's great, Neha, and I actually think that we all as researchers sit in these middle grounds often, and so it's something that, go ahead.
I just realized that, I mean, I'm saying I realize this is quite aspirational, but something that at least a few of us within the London School have been doing is sort of advocating for, I mean, I think I said this before, we know that the whole research ecosystem needs to change. So I appreciate that, you know, we then have early career researchers saying, you know, any institution saying, well, I need that first author paper because otherwise I'm never going to get promoted or whatever. And so I think been talking a lot with sort of, well, at least in London schools, how do we actually change our promotion criteria? You know, how do you actually embed equitable partnerships within that, talking to donors and, you know, building in additional time and resources. I know someone in the Q&A brought up, you know, how do you actually do this kind of work? And I think it requires a lot of changes. There's only so much we can do individually, but that doesn't mean we shouldn't try, or at least make some noise about it.
Absolutely. No, I think that's a great sort of, I think from the academic and how do we do this as researchers and how do we restructure our thinking? I think it's something we can all think about together, and practitioners, how do we engage? Hannah, I'd like to ask one question to you before sort of closing the event, since everyone has gotten at least a question. You know, just maybe in reflecting on what we've heard, if you could maybe speak to kind of, not the state of the field, but what do you think are areas that kind of need more investment? And also perhaps what are some of the global kind of funding mechanisms that currently exist? And maybe thinking about Neha's question, we can you know, think together about how, you know, do these align? What are the funding structures that exist? What are some of these mechanisms that are currently paying for some of the research that's happening? But then how, you know, those types of structures would need to adapt also to actually
90 seconds or less. That's a lot. I will try my best to give a couple quick thoughts that come to mind of sort of where we are and where we need to go. Is, you know, building on what others have said of, you know, inclusion in many respects. So, you know, including refugee settings of their, you know, all diversity in, including researchers from and research institutions from crisis affected areas as leads in this work. I think much of the research in humanitarian settings, you know, there's advantages and disadvantages to this, but is funded by humanitarian funding mechanisms, be they research or program related. And particularly in, you know, many crises is where, you know, parts of a country are crisis affected or the nature of a crisis changes over time. Much of that higher level global policy dialogue, global research initiatives, some of the work to set global guidelines to advance evidence is, you know, done in safer, more stable, calmer settings first. Or, you know, if you're looking at a country as a whole and research priorities, oftentimes, you know, these more challenging settings or, you know, vulnerable populations are more marginalized and aren't part of that, you know, national or global level research agenda. So I think both investing in, continuing to recognize that rigorous research and learning is feasible within humanitarian programming and is important, but also ensuring that it's not so separated that, global research initiatives, and I think we see a couple examples, supported by the UK and US governments, but hopefully shifting more attention to, other parts of the world and, other funding sources, engaging with, regional and in-country research networks to be part of that dialogue, to, recognize the complexity in context within a country and ensure that, research efforts reach all of those, and that those researchers and those universities in that part of the country, have equal voice to those in the capital or elsewhere to help direct this research. I think we're at time, so I'll leave it with those few thoughts. I think that was maybe 1 out of 5 questions you asked, but you gave us all a lot to think about, and really hope we can continue this dialogue.
Thanks, Hannah, and thanks to all the panelists today. I truly appreciate the time spent in organizing, thinking through these topics and presenting from your experience. I also wanted to thank several people who have made this possible. Danielle, Anne Caroline, Jessica DeMulder, several, and Ashish, of course, who have led the Humanitarian Task Force at the Council, and the organization of this event would not have been possible without all of their hard work. I'm not gonna, because we're over time, I'm not gonna kind of try to wrap up everything, but what I will say is that I think, we've learned a lot, we've heard a lot about engagement and thinking about how to involve those most directly affected in conflict settings, not just those who are the beneficiaries of services, but also those who are actually working in programs to deliver these services, engaging people who are activists, those who are from different disciplines who can help us understand what's happening on the ground, how do we improve access to education, sexual reproductive health services, maternal child health services, but that the framing, it's not even engaging, it should actually come from the communities themselves, I think is what we're hearing across the board, and to involve, whether in all aspects of research, whether it's developing the research questions, whether it's collecting the data, whether it's analyzing the data, interpreting, writing up, and really kind of advocating for this work. And I think at the funder level, what I am hearing is that there's a need for more investment in humanitarian settings, so we can do this, because research is often under funded, and the value of what you get from, say, the data collectors that are doing this work is often missed. And so how do we better improve the knowledge, whether it's qualitative knowledge, and how do we transfer that to our programmatic learning? So I will stop there, and I hope people continue to ask questions. Thanks to all of those who've asked questions. We will try to get some responses to you in some format following the event. I know several went unanswered, but I know thanks to all the panelists for answering questions during the session as well. So thanks a lot, and good morning, good afternoon, good night. Hope to connect with all of you soon.